Good morning, this is Dr. Arian Mowlavi. Today I wanted to share with you all what HD Lipo 360 means. So HD is high definition, liposuction is lipo, and then 360 means circumferential. A lot of patients ask me, what does that mean? Why is it so important? And what does it mean for them? So it's high definition, liposuction 360. The high definition means the concept that we've been preaching about and pioneering. It means that the outcomes have to be really beautiful and majestic and real masterpieces. So it means that the muscle highlights have to show, the curves have to be exaggerated. It's what makes an outcome superior to traditional body contouring. The liposuction obviously means liposuction. And then 360 means circumferential all the way around. So I want to talk to you all about what that all means. So when you talk about HD Lipo 360, what we're talking about is to contour your body from the shoulders all the way down to the knees and all the way around. I mean the front, the belly, the armpits, the sides, the flanks, the back, upper, middle, lower back flanks, the bottom, whatever it is that you're concerned about needs to be fixed. So why is that important? And it's twofold, and that's what I wanted to discuss with you all today. Number one, when you talk about HD Lipo 360 and why it's so important to go all the way circumferential, is that we want you to look magnificent from every single view. Whether someone's looking at you from the front, from the side, from the back, next time you're in Vegas and you're at the pool, from any angle, you should really look incredible. So that's why the 360 is important. That's number one. There's a second reason that I wanted to share with you all. And if anybody does their homework and goes online and looks at questions that patients pose, they will often state this fact that's a misconception. They'll say, Dr. X, Y, or Z lipoed my belly, and then 6 months later, all the fat went to my back, right? So the fat actually didn't go to the back. And this is what I wanted to share with you all. When you do 360 lipo, it's protective, and this is what I'm talking about. Let's say you come to me and you do your liposuction and then you gain a couple pounds, 5 pounds, even 10 pounds. When you do a 360 lipo, it's actually protective. Protective of you looking like you have another concern area. So this is what I wanted to share with you all. The reason we do the 360 is because you look amazing from all angles, but more important, it's actually protective. So what this means is that if you do put on a couple pounds in the next year or two or down the line, it's not gonna show because we've completely eliminated all the fat and left you with no concern areas. So what happens is if you gain weight, you gain girth in the areas where you have a lot of fat. So that's why it's so important to be comprehensive and go all the way around, because now if you gain weight, there's no fat anywhere that can gain in girth. And that's what all the patients that you might hear online talk about when they say, oh, doctor lipoed me, but then it went somewhere else. It's not that. It's because the doctor did not go 360 and left you with areas of fat deposition that now can grow if you gain weight, because you're not gonna gain it where we liposuction, because all the fat is gone. So the idea of the 360 lipo is to completely and comprehensively eliminate any problem spots where you might have depositions of fat, so that even if you gain weight later, it's protective and you'll still look great. And that is what I wanted to share with you all today. Thank you.